When can we start? Shall we wait for 2 more minutes or can we start the class? Okay. So, good evening, all. Shall we start the class? For first 10 minutes, we'll see the recap of last class. And after that, we'll go to a new topic called as anxiety disorder today. So, anyone is willing to give summary?
Good evening, ma'am.
Good evening.
This is Afrin.
Yes, yes. Hi, Afrin.
Yeah, ma'am. Last class we saw psychosis and neurosis.
Yes, yes.
We saw what is definition of psychosis,
Okay.
and then key features:
Mm.
hallucination,
Okay.
delusion,
Mm.
disorganized thoughts,
Mm.
disorganized or abnormal behavior,
Yes.
and then we saw causes of psychosis,
Okay.
mental health disorder, substances use, medical
Mm.
condition,
Okay.
and then diagnosis of psychosis.
Yes. Yes.
Treat, treatment for psychosis.
Treatment for psychosis then.
Yeah, medication, social support, psychological therapies. And then we saw neurosis,
Okay.
definition of neurosis, key features:
Okay.
anxiety, irritability, phobias, obsession and compulsion, depression or sadness,
Mm.
somatic symptoms. And then causes of neurosis, treatment of neurosis.
Okay.
That's it, ma'am.
Yes. Very good. Thank you. Thank you so much, Afrin. Yes.
Thank you,
So,
ma'am.
yeah. So whatever told, that is the summary. Like those are the topics we saw in last class. Yes. So just I'll go through once. She covered majority all the topics, so I'll just go through once. So what is psychosis? As she mentioned, like we saw, it is the loss of touch with the reality. And we saw what are the types, in like what are the objectives or types to be concluded as psychosis. So hallucination, delusion, disorganized thoughts, disorganized or abnormal behavior, the difference in their behavior, and negative symptoms. And I took some time to explain about negative symptoms and positive symptoms. So I hope you guys are clear in that. And next, we saw about causes. So what actually causes this? Okay. So in that we saw, like if we have any kind of mental health disorder, like that one of the symptoms will be psychosis, not like it is not like separately a disease, but one of the symptoms in mental health disorder would be a psychosis. And also the person who's like using drugs, or who's using like alcohol, or like who's having withdrawal symptoms. Like withdrawal symptoms means the period where we are put in a rehabilitation center, and we are like restrained from using those items like alcohol or cocaine or anything, drugs. So in that, during the withdrawal symptoms also, some people will get psychosis because of the change in their neurochemical transmitters. And in some medical conditions involving the brain and its functions, majorly, like the brain injury, like tumor, like Parkinson, like dementia. In all this dementia, I hope people know it's memory loss. In that medical conditions also, people might experience psychosis. And fourth is extreme stress or trauma. So intense psychological stress, okay, after some life changing or some major loss, can lead to psychotic episodes. Episodes is nothing but short period. Like it is not like sustained throughout our life. It is like short. In short, we'll have like 1 day, 1 week. So it is called as episodes. So in during that also, we will get psychosis. Next, diagnosis. So diagnosis, how we'll diagnose? So using interviews. What kind of interviews? Clinical interviews, assessments, and medical test like MRI, blood test. So to rule out other causes. Next, treatment. So people just note it for any disorder, okay? For anything, what we are going to learn, like anxiety, OCD, any disorder. First, we'll see what is that disorder. Next, we'll see what are the causes, like what can cause this disorder. Next, we'll see how to diagnose that problem or disorder. Fourth, we will see what are the types. So types in the disorder, what are the different kind of types we have in that. And in sixth, we'll see what are the treatments available in psychology or psychiatric field to deal with the disorder. So these are the things we are going to see in under each disorder. So we'll go in that order only. So kindly note it down. So here also we saw how to diagnose it. And treatment is medication, social support, and psychological therapies. I hope I explained about this in last class. Next, neurosis. So neurosis is, it is not losing our reality. We will stay with the reality. Will remain in touch. Okay. And here this is just a mild mental and emotional disorder. Okay, like anxiety, fear, phobias, like that. Key features. So key features is nothing but some categories we are seeing. For example, how we saw their hallucination, delusion, like that. Here some categories. So like anxiety, irritability, phobias, obsession, compulsion, happiness, sadness, somatic symptoms. And each topic we are going to see deep in further classes. Okay, so no problem. We are going to deal with each and every like this topics categories in detail. So, as I mentioned, causes. So, causes is stress and trauma, personality, environmental changes, and biological factors, nothing but neurological changes like our brain function changes. Treatment. So, treatment is psychological therapy like CBT, talk therapy, dialectical therapy, and next is medication, like putting the person in anti-anxiety medication or antidepressant according to the disorder. Third is self-help and lifestyle changes. Like because here the person stays with the reality, right? So self-help comes into picture. In psychosis, the person cannot help himself. Okay, he should be under medical intervention. Here, the person is staying in touch, so he could help himself. So self-help and lifestyle changes. Yeah, this, next. I think till here only we saw in last class, right? We saw some quiz. One second, people. My system is getting. Yeah, anxiety disorder. Today only we are going to see. Did we see about anxiety disorder, or today only we are going to see?
Today only we're going to see, ma'am.
Today only. Okay, okay, okay. Thank you. So here we saw some quiz about psychosis and neurosis. So last class we were dealing with psychosis and neurosis. Today only we are going to start with anxiety disorder. So we'll start the class. One second. I'll share the screen. Yes. Okay. Yeah, is it visible?
Yes, ma'am.
Yes, ma'am.
Okay, okay. We'll start slideshow. One second. Okay. So anxiety disorder. So here, okay. Now, people, you tell me what is like anxiety disorder comes under psychosis or neurosis?
Neurosis.
Neurosis.
Neurosis. Yes, very good. Yeah, neurosis. Because here the person will stay in reality, right? He doesn't lose the contact with reality. So it comes under neurosis. Okay. See, any doubt you're having, you can note it down. At the end of the class, we'll deal. Each disorder will deal in detail. So don't worry, like that's all the information. Some points will be discussed in next class also. Okay. So don't worry. Just note down whenever you have a doubt so that we can get it clarified at the end of the class. Okay. Okay. So what is anxiety disorder? So sometimes, yes, first, you people will have an idea, right? Whenever you, because see, psychosis is something which is a new to us, like hallucination, delusion, and all new to us. I know that. But here, about neurosis, coming to neurosis, we people every day we come across the words like stress, depression, anger issues, anxiety, phobia, OCD. So every day in our regular life, we are hearing about these names and all. So we are coming across these names in general. So according to you people, what is anxiety disorder? What do you think about anxiety? Just what is anxiety? Any idea? If it is wrong, also no problem. Just try answering. No, what is anxiety according to us in general terms? See, every day in our life we'll say, right, I'm feeling so anxious. I don't know, I feel so anxious today. The students or kids we have, like when they have some presentation in class or exam is there, they'll say, I'm so anxious today to present this. So what is anxious? Worrying about everyday situation. Yes, very good. Worrying about overthinking. Yes, yes. Yeah. So overthinking, nervousness, worrying, this and all we know in general, right? So today we'll discuss in depth Okay, this all are right, but what more? Okay, yeah. So note it down. Anxiety disorder is a mental health condition. Okay, where a person experiences excessive fear. The key point is excessive fear, worry, or nervousness that interferes with their daily life. That means we will think like only nervousness is anxiety, but to tag the see anxiety regularly, each and every one of us will experience anxiety somehow. Okay, but to be tagged as anxiety disorder, note the word disorder. To tag it as a disorder or disease, we should have excessive fear, not fear, excessive worrying or nervousness that interferes with their daily life. So their daily life get affected because of. You remember the word functionality? I mentioned in neurosis, right? Whatever is affecting our functions, like daily functions or functionality, that comes under disorder. So here, that interferes with their daily life. Okay, while feeling anxious, sometimes it's normal, as I mentioned, like I told, right? Like before a test or interview, or to give a speech, a presentation, to talk before the class. So here and all, people will feel anxious. It is very normal. Okay. Okay. But in anxiety disorder, the difference comes here is happens too often or too intensely. So this is not like normally feeling. It is like regular basis we'll have episodes. Like in regular one day we'll have like 10 times we used to feel anxious. Okay. So it's like regular happening. Okay. So too often or too intensely. It's not generally like nervousness. Here the person will have physical symptoms like rise in heartbeat, palpitations. He couldn't talk properly. He couldn't smile. The like intense emotions. Okay, okay. Is then second point is out of proportion to the situation. See, to give let's keep the student have to give a speech in the stage, so everyone will feel anxious, right? This is normal. But if the student is like fainting, it's like his heartbeat is rising, he's like sweating like something, he couldn't even walk, he just reaches the stage and he faints. There, it comes out of proportion to the situation. Can you get the difference? Out of proportion is something there, the regular, there is a difference between the regular happening and this symptom. Third is affecting functionality, as I mentioned. What is functionality? Our daily life. That is affect school, social life, or health. Okay. So these are the three things to get it different, like to differentiate it from anxiety. As an anxiety disorder, we should have these three things. That is, it happens too often, it is out of proportion, and it affects our functionality. Am I clear? Is it clear? We'll go to
Yes,
next slide.
yes, ma'am.
Yes, yes, thank you. Next, as I mentioned, for any disorder, what and all we'll see what is the disorder, what are the symptoms, diagnosis, causes, treatment. Okay, so here coming the symptoms. Key symptoms means we'll have so many symptoms, but majorly, okay, because you should not think like, okay, only this four. No, many for each disorder there might be many minor symptoms, but here only we are dealing with major symptoms only we are seeing. Okay, so key symptoms. See, for people note this also, for any disorder, okay, for any disorder, we will see that in four lens. Okay, put a circle, okay. Uh, for any disorder, we will deal it with four lens, like four perspective. First is emotional, next is physical, next is cognitive, then behavior. So psychology itself it deals with this four. Okay, so always remember any disorder you take, any issue you take, you should see that in four perspective, how it is affecting our daily life. So that four perspective is nothing but very simple. First is physical, our body changes of the disorder. Next is cognitive, thinking, mental. Okay, so physical, next is thinking, which is cognitive. So second one is cognitive. Third is emotional, not only thinking, because of the thinking how our feeling is, how we are behaving, like sorry, how we are reacting or how we are feeling. Okay, how we are feeling is emotional, and how we are reacting. Our action is behavioral. Are we clear in this? So every disorder we have to see in four perspective, which is physical, cognitive, which is thinking, emotional, which is our feeling, behavioral, which is our action. Okay. Here, these are the categories. Now we'll come to the symptoms. Okay, that are falling under each categories. First is, we'll see physical. Okay, first we'll go in that order itself, so it will be easier to understand. First is physical. So what are the physical changes we'll get when we get into anxiety disorder? So this people can judge very easily, because generally with anxious we'll feel like fast heartbeat and all. Here something, it will be intense. That is the difference. See, some you cannot think like, okay, when I am anxious also I'm having fast heartbeat, I'm having sweating, I'm having stomach ache and all. Here, the difference is this will be very intense. That is the word, intense, very very intense symptom. Okay, so first is fast heartbeat. Okay, second is sweating. The person will sweat like something. Next is dry mouth. He couldn't even talk. Okay, he feel like very dehydrated, dry mouth. Next is stomach ache. Next is dizziness. I told no, he'll reach the stage and some people will fall down in that anxious feeling. So dizziness. So these are the physical changes the person gets in anxiety disorder. Next is cognitive or thinking. Okay, so what happens in the person's mind? See, whenever I'm discussing about a disorder, just think about the person or a patient. Okay, so you should think about that patient is having all the symptoms or the all this category of symptoms, then the understanding will be better. Okay, so that just think that person, what is going inside that person's thought? Nothing but raising thought. Like raising thought is, he cannot like think about one thing. He or she cannot think about one thing. The thoughts will be very fast. Okay, and trouble concentrating. The person, someone will be talking to him, what happened, are you okay? But this person, right, he couldn't even hear any of the words, or he couldn't concentrate anything, because already in his mind lot of things are going on. Okay, and as in chat we saw, overthinking. Overthinking is anxiety disorder. Okay, comes under. So here, the person physically is facing so many things. In his mind, he's having trouble concentrating. He's like overthinking, like overthinking. He's having racing thoughts. Okay. Now, because of this, what will be his emotion? Like, what will be his feeling? What? Constant worry. Constant worry, restlessness. Okay, fear of the worst happening. So in anxiety only we'll have this word coming again and again, fear of the worst happening. So when we say, see, it's basically going and giving a speech in the presenting something in the office. Okay, but here the person will be thinking lot of overthinking, that will result like, what if I'm not presenting it well? What if it goes wrongly? Fear of the worst happening. What if everyone will start laughing at me? So because of this, he'll face so many physical symptoms. Okay, so that is what the person will be feeling. So fear of the worst happening. Okay, fourth one, what is the action because of all these three? Avoiding people or places, fidgeting, needing reassurance. So, avoiding people or places means nothing but he won't even attend the meeting. See, he'll think like what to say. He'll think like, okay, what if I go and attend, the people laugh at me? What happens? Because of this, he will stay in some he will avoid attending the meetings also. He will avoid going to the schools. He will avoid the people. He'll stay in a closed room because of his thinking. Okay, so because of his thinking and constant worry, he will avoid everything, the places or people. Okay, fidgeting. What is fidgeting? Anyone have idea what is fidgeting?
Biting nails, tapping foot.
Yes, yes, very good. Yeah, the moving restlessness, that biting nails in nervousness, tapping the foot on the tapping the foot on the foot, and some will keep some objects in the hand, and continuously continuously using that thing. It's like moving very restless. Fidgeting is nothing but we'll have some involuntary movements, okay? Like as she mentioned, tapping the foot. So involuntary movements will be there, okay, without even that person knowing. He'll be doing some small and involuntary movements. That is what fidgeting is, okay? So that is his action. Okay. Next is needing reassurance. So he always needs someone to tell, okay, nothing to worry, nothing to worry. But as they tell also, here the person will not accept it. Again and again and again, they need reassurance. Okay. So that is one of the behavioral symptoms. So this fidgeting is mainly because of the stress hormone. Okay, so they have intense energy. Okay, so they, because they are avoiding people and everyone, that intense energy they will show by like biting the nails, tapping the food, like that. Okay, these are the behavioral symptoms. So is the symptoms clear? That is the emotional, physical, cognitive, behavior. So yeah, it's the symptoms like this. These common symptoms are dealing with this category. Okay, so in anxiety we will have all this four. It's not like one. The person will have worrying also. The person will have, yeah, the person will have all the physical symptoms also. The person will have trouble concentrating. The person will avoid people or places because of this. He will not he'll he'll not attend the school. He'll not go to the meeting because of the intense anxiety feeling. Okay, so he or she needs reassurance. So these are the key symptoms. Yeah, so see See, these are the symptoms. I put like four categories into one picks. What are the symptoms? Fatigue, excessive anxiety and worry, restlessness, irritability, difficulty sleeping. Why difficulty in sleeping? Why the person is finding difficulty to sleep? Any idea why difficulty in sleeping coming?
Overthinking, ma'am. Because of overthinking.
Yes, very good. Yeah, because of that racing thought, that overthinking, he or she cannot sleep because their mind is always occupied with thoughts like what will happen tomorrow, how to deal with this, what. That question keep on going into their mind. They cannot sleep. So difficulty in sleeping. Next, increased muscle aches and soreness. Why increased muscle aches and soreness? Because we saw, right, fidgeting, because of all the physical symptom, the stress hormone, because of the stress hormones, their heartbeat is rising, all type of physical symptom. Because of this, they have increased muscle aches and soreness. Okay. Impaired concentration. We saw this earlier. That is trouble in concentration. They cannot concentrate in one thing. Okay. These are the common symptoms in anxiety disorder. Yes. Now causes. Coming to the causes. What causes anxiety disorder? We should know about the causes, right? So what causes anxiety disorder? So anxiety is caused by a mix of biological, psychological, and environmental factors. So it is not one thing. It is not. It may be one thing, but majority neurosis and all. It is because two to three things. It is a mix of biological, psychological, and environmental. Okay, what is biological? Always I'm telling, like, biological means dealing with brain. Psychological is dealing with self thinking. Environmental is dealing with society. Okay, it's clear. So we'll see what is under each category. So biological factors. Imbalance in brain chemicals like serotonin. Okay, so we have like neurochemical transmitters in our brain, okay, like serotonin, dopamine, oxytocin. There are so many like types of brain chemicals. In that, sometimes because of the imbalance in this neuro like transmitters, this neurochemicals, we will experience certain kind of emotions. For example, oxytocin is they'll say birth hormone or love hormone. Like each women when they are like going to deliver their baby, they'll get the release of oxytocin will help them like to they'll say it will decrease the pain. So sometimes in hospitals they will induce using oxytocin. So oxytocin is bonding hormone. Okay, it is like very much needed. Okay, like this, we have some neurochemical transmitters, okay, like serotonin and all. So imbalance in this will cause some disorders. Next, overactive fear response in the brain, especially the amygdala. So this and all we'll see in detail. And because see, this words and all is going to come again and again. Just note the word amygdala. It is one of the very important word in psychology. I hope. Does anyone know what is amygdala already?
The
Already
happy
heard
Amygdala.
hormone,
about.
ma'am.
Sorry.
The happy hormone.
That is happy hormone is oxytocin. I'm asking what is amygdala? Amygdala. Any classes you have like already heard about amygdala, or this is the first time?
No, ma'am, already heard this word, but I don't know correct meaning.
Okay, I'll tell. Okay, nothing but in psychology, this amygdala plays a very major role. Amygdala is nothing but in our brain. Okay, in our brain, many structures are there, right? Like cerebrum, cerebellum. Like we have like medulla oblongata. We have so many structures, right? And each structure it deals with things like cerebrum is for thinking, temporal lobes for hearing. We have so many like lobes and divisions in our mind. Okay, in that division one thing, okay, name is amygdala. So amygdala is nothing but a shape, almond shape. It will be in like an almond. Okay, very small. Okay, it is located in brain. Okay, in our central brain it will be located. Okay, it is a almond shaped structure of part located in brain. So what is the role of this amygdala? Amygdala, when the word you see that, you have to think it is emotions. That is, this part only deals with our emotion, particularly our aggression emotion, like our anger and fear emotion. These two emotions, particularly this amygdala only it's dealing with. Okay, so amygdala is a brain function, brain thing. Okay, it is located in our central brain. It is mainly responsible. See, just note it. Amygdala is called a seat of emotion. Seat, SEAT, seat of emotion. Seat means what? We used to sit, right? Our emotions are sitting down, are sitting down in our amygdala. Okay, it is the seat of emotions. Okay, so seat of emotions, and this is responsible for our feelings like fear and aggression. Is it clear?
Yes, sir.
Yeah, it is for emotional processing mainly. Okay, and also we are facing some things in everyday life, right? So one day we'll be happy, one day we will be sad. This everything are going and storing in our brain in amygdala only. Okay, so amygdala will have it will control our emotions. Like we are making decision making, we are making like we are understanding a problem, we are storing about an emotion. Everything is getting stored in brain in amygdala region only. Okay, so it is mainly near, it is in the inner brain. We'll see in detail about amygdala because see, in many disorder brain function problem and all, some people they'll get brain injury and their amygdala get affected. After that accident, right, they are total, we'll see that him or her as a different person. He'll not feel any emotion, he'll turn into very aggression type. See, there are some case studies also. They have learned like this accident patients, right, whose amygdala got affected. They just observed that person and they have learned and they have um, drawn so many conclusion. Okay, so we'll see the case studies. When we are seeing case studies, I'll share 2 to 3 case studies of amygdala, about amygdala dysfunction also. Okay, so now just know amygdala means seat of emotions. It controls our emotions, it stores our emotions. Intense emotions like aggression and fear are coming from amygdala. So it is an almond shaped brain structure. Okay, so here also biological factor, overactive fear response in the brain. Okay, that is amygdala. Next is psychological factor, negative thinking pattern and low self-esteem. So some people writes, you can know, basically they'll be like whatever the problem comes, their mind first think about negative only. What the outcome, for every action there might be positive outcome, neutral outcome, negative outcome. But you have observed some people first their mind, it will think about negative outcome only. What if this goes wrong? What if I'm not succeeding in the exam? What if my office colleagues think I'm not incapable? So some people defaultly they'll have negative thinking pattern, so that might cause anxiety disorder. Okay, next is low self-esteem. So low self-esteem is the mirror, like how we see ourselves, right? That is self-esteem, right? Low self-esteem is something, they will think like always they'll think about themselves. They'll have very what to say, they'll think they are not capable. They will have so a very low self love. Okay, they'll think like they are not capable, they are not successful, whatever work they are taking they cannot be successful, always putting them down. So this and all psychological factors. Basically, that person will be thinking like that. Okay. This also can cause anxiety disorder. Next is environmental factor. So from society, what is happening? Society means stressful events. First, from society, when we interact only, events are coming into picture. So stressful event like bullying, exams, family conflict, this and all may cause anxiety disorder. Trauma or abuse. So trauma or abuse also causes anxiety disorder. Sometime family history of anxiety. So in psychological disorder, many time you see whomsoever the client or the patient coming, we will take the family history from that patient or the person who's coming for the session, because sometimes some disorder that runs through the family. So schizophrenia, anxiety, this and all, it runs through the family. So family history of anxiety can also be a cause for anxiety disorder. Is it clear? Any doubt in this? Yes. Okay. 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 So we'll go to the next one. So these are the causes. So treatment and types of anxiety disorder we are going to see. Okay. Yes. So here I have given in a picture. So what are the types of anxiety disorder? So we know now, now we know what is anxiety disorder, right? When someone asks, we can able to tell the 4 categories: physical, cognitive, behavioral, and emotional, right? Now, what are the types that are we are going to deal with anxiety disorder? First type is generalized anxiety disorder. In short they'll say GAD, GAD, GAD. Okay, generalized anxiety disorder. Second is social anxiety. Third is separation anxiety disorder. Fourth, phobia. And fifth is panic disorder. I hope people you have heard about this and all, right? Social anxiety, separation anxiety, phobia, panic. I think generalized anxiety only will be new. Panic disorder, phobia, this and all in everyday life. Some people use this. I have like phobia for this. I have phobia for height and all. So this and all comes under anxiety disorder. Okay. So these are the 5 types. Just note it down. GAD, social anxiety, separation anxiety disorder, phobia, panic disorder. Now we are going to see about each type in general. Yes. Generalized anxiety. I told no GAD. So what is generalized anxiety disorder? First, persistent excessive worry about various aspects of life. See, from the word itself, we can note it like it is not anxiety disorder. It is called as generalized. So, in general, about various aspects of life, the person will feel anxious. Now, can you get it from the name itself? Generally, general means see specific means one thing. General means many things, right? So generally, so it is about various aspects of life like health, work, relationship for at least 6 months. So this is the keyword, people, for at least 6 months. It's not like, see, one thing for sure, when we are studying about disorders and all, we'll sometimes get the feeling like I'm having this. Okay, I also worry about various aspects of life. I also have excessive worry, but that doesn't define us as a person having anxiety disorder, because here, see, the keyword is for at least 6 months. At least, so minimum 6 months. Okay, so what is generalized anxiety? Persistent mean continuous excessive worry about various aspects of life. It may be like work, our relationship with family, our health. So for at least 6 months. Okay, so what are the physical symptoms? Because of this, what are the physical symptoms you will feel? Because this is basically every like continuously you'll feel, right? So the person will be restless. Because of the restlessness, the person will always feel tired or fatigue, because his mind is always working in the back. He's always feeling some tension. So because of this, he'll always feel tired or fatigue. Okay, muscle tension, irritability. The person will always be irritated for no reason. For us, it will be like no reason. For him or her, it is because of many reason. Okay, so irritability, as we saw earlier, sleep problems. Because of overthinking and everything, sleep problems. So, what are the psychological impact it will have because of this? Because each disorder we are seeing, and we also saw, it will affect in our daily life functionality, right? So, how it is affecting? That is what the psychological impact. Okay, individuals find it hard to control the worry. So see, we people sometimes will get worry. We'll feel very nervous. But that time, we'll help. Like sometimes a voice inside us will tell, "Don't worry, you will deal it. You will crack it. You can talk. You will face the crowd. You will nail it." So we'll have some voice, right? Inner voice. So here, the individual find it very hard to control the worry. The inner voice will not even work for them, because their mind is always occupied with thoughts. So the inner voice doesn't even come into picture. Okay, so this is generalized anxiety disorder. Am I clear? Is it clear?
Yes, ma'am.
Okay. So now coming to the second one, panic disorder. So panic, okay, anyone, what is panic disorder? We have heard this also in daily life. What is mean by panic? So person saying I'm panicked, what is the meaning of panic?
பயம் மேம்.
Bayam,
எதை
correct.
செய்யறதுக்கும் இதுக்கும் பயம். தப்பா
Yes, bayam.
போயிடுமோ.
Yes, that fear, right? Nam bayam. So correct. Yeah, panic disorder. So bio is fear. But to get it like differentiated as disorder, what comes into picture? Intense fear. So here that fear will be enormous. In the scale 1 to 10, it will be like above 10. That is the difference. Okay, panic disorder means it will be very intense fear. Okay, so what is the symptoms? Recurrent. Okay, recurrent means with certain break period, it will again and again happen. That is recurrent. There, the word is persistent. Persistence is continuous. Recurrent means with breaks again and again happening. Okay, so recurrent, unexpected panic attack, sudden period of intense fear accompanied by physical symptoms. So we see it is not like expected. We'll be sitting there, suddenly they'll have panic attack. So sudden, unexpected time. Okay, so recurrently it will happen. We have seen people in some movies and all. They say the person is having panic attack. So it is like unexpected. Okay, sudden period of intense fear. So how to find the person is having panic attack? The people who are surrounded can find that person is in panic attack. Why? Because of the physical symptoms. Okay, because there will be physical symptoms also here. Not only it is going on in our mind, outside people also they can see that person is going through something because of the physical symptoms. Okay, so what is the physical symptoms? What are the physical symptoms here? First is heart palpitation. Heart palpitation means high heartbeat. They'll tell no pada 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 irukku. So heartbeat will be very high. Okay, chest pain, dizziness, shortness of breath, fear of dying. So here in panic attack, the person will collapse and sometimes they'll fall in floor, thinking they're going to die because of the chest pain and all. See, when they're having palpitation, they're having high heartbeat, they're feeling like they're going to faint down, they're having short chest pain, they couldn't breathe properly. Automatically, what the person will think, okay, we are having a heart episode, like heart attack. We're going to die, right? They'll collapse in ground. So by that only other people know, okay, something wrong with the person. He's having a panic attack. Okay. So here the physical symptoms will be intense. The fear of dying will be there because of all these symptoms. You can see, right? See, above we saw restlessness, fatigue, irritability. That and all will not be fearing because it's regular thing. But here, chest pain, dizziness, breathing problem, heart palpitation means automatically the person will get, oh my God, okay, something is going to happen. Okay. So that is panic attack. Psychological impact. What happens when a person get all these things? Automatically he will fear about future attacks, right? He'll always be anxious, like, oh my God, when I'm going to get again panic attack? When is this going to happen again? Is this going to happen tomorrow? He'll always be fearful, often leading to avoidance behavior. So they will not attend social meeting. They'll not go to they'll not attend, like if the school. They'll always have the fear, what if it happens there? What if I do not have any support system there to save me? What if I'm alone somewhere? So often leading to avoidance behavior. They'll stay at home. Okay, so this is panic disorder, and that physical symptoms comes under panic attack. That short episodes I told, no, that is panic attack. Generally, this everything is called as panic disorder. Okay, so we saw two types. What are the next type? Yeah, phobia. So yes, what is phobia? This also every day we have heard. What is phobia? Phobia.
It is also a type of fear, ma'am.
It is also
Claustrophobia.
type of, yes, yes. It is also type of fear. Yeah. Yes, yes, very good. Yeah, it is also type of fear. You mentioned, right? Specific. It's not generalized. Specific, right? Type. So we have so many types under phobia. Okay. So first is, I think we have phobia disorder alone or separate topic. I think But now we'll see in short what is specific phobia. So it is intense, irrational fear of a specific object or situation. See, for example, irrational fear is nothing but there will not be any proper reason to be fearful at all. Some people they'll be like, okay, they'll be fearful about certain people. Okay, see, they are going to a marketplace. They want to buy some vegetables. This person will not go. Okay, the mother is telling, or the husband or wife is telling to buy some vegetables. This person will avoid. He will not go because he or she will think, if I go there, okay, something will happen to me for sure. Okay, intense anxiety will be there. This is this rational or irrational? If I go to the market, something will happen. Is this rational or irrational?
Irrational, na?
Yes, irrational. Because for rational fear, you should have some reasons, right? Yeah, irrational. So, for example, to have a rational thing, you should have some reason. Okay, if I go there, this will be the situation, and because of this person, I can get attacked. This is rational because something I have fight with him already. I had issues with him already. This is rational, but you don't even know the person. You don't even know that group, but you think, if I go and buy vegetable like a normal people, I would get attacked. So this is irrational. Okay, this is just for an example. I told about market that comes under agoraphobia, like avoiding certain settings. Okay, like this, so many things are there. Acrophobia, fear of height. We'll see in detail. Okay, don't worry. So now, just to remember, it is intense, irrational fear of a specific object or situation. So it may be an object also. It may be situations also. Now I explained about a situation only. Market object is nothing but a thing. So, for example, like spiders. So they'll have like intense fear. Okay. So spiders, height, flying. So they'll avoid the airplane. They'll not go in airplane and all. So they are very much concerned about heights and all. So this is phobia. It is specific phobia. Okay. Because it is not because of everything. It is because of certain things, specific things. Okay. So what are the symptoms? Avoidance of the feared object or situation. Intense anxiety when exposed to nothing but that person, he won't even climb stairs. Let's keep his office is in 10th floor. Okay, he will avoid going there. He'll just tell some reasons. He cannot go there. If he goes also, he'll feel intense anxiety. When he has like the fear of height, I'm telling. He cannot even face it. Okay. That is what avoidance. Avoidance of feared object or situation. But what if he is exposed to it? We are avoiding. Okay. See, the person is avoiding. Doesn't like spiders, so he will not hear his name. He will not see in TV. He is avoiding. What if actual spider comes near him? What happens means intense anxiety. Anxiety symptoms we saw in last page, right? That had a panic attack and all. So that intense anxiety will the person will experience that. Okay. So common types. Some common types. We'll see many things. Okay, don't worry. Phobia we'll discuss in detail. We have so many types. We'll see about each type. Just know for generally animal phobia. They'll be fearful for certain animals. Um, it may be like wild animal or sometimes for dogs. Sorry. Okay. So animal phobia. So next is situational phobia. I explained right, marketplace. That is under situational phobia. Natural environment phobia. Example storms or any natural like it's raining, something like that. Natural environment phobia. Next is blood injection injury phobia. This all we'll see. Okay, don't worry. So these are all certain types of common types. Common types. Okay. Generally, people will have this in phobia. Next is social anxiety disorder. The name itself is explaining, right? What is social phobia? We saw specific phobia. What is social phobia? Any idea what is social phobia?
Participating in programs.
Yes. Yes, I told right the stage fear, the giving a presentation before colleagues, that and all comes under social phobia. Yes, very good, thank you. So, social anxiety disorders, intense social or performance situation, where one person takes class, he'll think what the people will think about me. What if always I told no, in anxiety they'll always think what the worst that can happen. What if I'm not able to perform good? What if people dislike me? What if they judge me? What if? You see, just note where and all this what if is coming, there will be anxiety. Okay. So intense, yeah, facing crowd, for giving a performance, to give a speech. So it is basically about a situation. Okay. So intense fear of social or performance situation where one might be judged. So common fears what? As she mentioned, speaking in public, eating in front of others, meeting new people. Because they'll always have in mind, see, I'm eating with spoon, I'm eating in hand. What if people think bad about me? Always they'll have the thought that they'll be judged somehow. Because of this, they'll avoid that situation. Here in anxiety, one common thing you'll see in all the categories is people will avoid the situations or things because of the fear, because of the worryingness, they'll avoid it. That is one of the common feature you can see in anxiety in all the types. So here, meeting new people and all. So what are the behavioral symptoms? Avoidance. I mentioned right. So avoidance. It is one of the common thing you'll see in every anxiety thing. Avoidance of social situation. Fear of embarrassment. They'll always see nothing like embarrassing things would have happened, but they will always have that fear, the fear of embarrassment. Okay. Is it clear? Yes. Now coming to the next type, agoraphobia. So I think I explained. Okay, they've given. Yeah, why they given in this? See, phobias they have put in one topic, right? Why agoraphobia alone? They have separately put in detail means many people have this. So major category they have separated this anxiety into 6 categories. Okay, because many people have this in unique. Like they can see many people with this. They have put this into a separate category. That's why that is specific phobia. There we saw agoraphobia is a specific category. Okay, fear of being in places where escape might be difficult or help may not be available in the event of a panic attack. See, nothing but the person will imagine in his mind that if I go to the marketplace, okay, if I go to my office, if I go to this place, okay, I cannot escape, something will happen to me. What if something happens? I cannot escape. And also, if something happens, if I get a panic attack, I don't know anyone there, so there will not be any help available to me. Can you understand this? Can you understand? See, I'll tell. It is generally it is a fear for open places. Okay, because in open places they might not know everyone. Okay, they'll just think, what if I have panic attack in that open place? What if I don't have anyone to save me? And also, exact opposite to this also they'll feel. What if I am alone in my home and if I have a panic attack and there is no one to save me? So this is two type. It is like intense in open place or in situation like where I'm alone and I have something in where I have like um, panic attack and I have no one to save me. Okay, can you like understand? Because of this, they will not leave their home sometimes. They will avoid the crowd and lines. They will not go to a closed places. They will not go to the open places also. Like basically, they will avoid everything. They'll not stay at home, they'll not go outside, they will not go in line, they will not go in crowd, everything they'll avoid. Basically agoraphobia, why they have given us a separate category means here the person avoid every kind of situation. He cannot be in open place also, he cannot be in closed place also, he cannot be with the crowd also, he cannot be alone also. Can you get how difficult it for the person because of this? Okay, often associated with panic disorder. We saw, right, panic disorder, specific panic disorder. So agoraphobia is nothing but it is a type of phobia only. But here, the person avoids everything. So it is given in a separate category. He cannot be in crowd. He cannot be in closed place like that. Sixth is separation anxiety. Nowadays we are hearing so many terms like separation anxiety. Separation. What is separation anxiety? Any idea? Separation anxiety. Any idea what is separation anxiety? Have anyone heard about this term? Separation anxiety. Majorly in kids, we can see this. In babies also. Small babies also of age 2 and 3. There also you can see this. So what is separation anxiety? Okay, I'll explain. Nothing but separation anxiety is excessive fear or anxiety about separation. So, from whom we are getting separated? From home or loved one. So, some people they'll tell, right? They'll always tell, I'm having homesickness. I'm so sick. I cannot, like, they'll go to some new places, but they'll avoid people because they'll tell, I'm always thinking about my home. I cannot go out and mingle with people because I'm always I'm having anxiously I'm feeling because I'm away from my home. I cannot normally I can talk. So this is what separation anxiety is. This is primarily seen in children, okay, because they cannot like leave their mom. You have seen, right? Many people, many kids, no, they'll for to going to school itself they'll cry. They cannot go to school. So during LKG, UKG, and all to drag them out of home and put them in school itself, it will be a big issue because they'll start crying. They cannot leave the home. So that is what the separation anxiety. They cannot leave the mom. Okay, they will be so attached to mother, so that they cannot leave them. So excessive fear or anxiety about separation from home or loved one. So what are the behavioral symptoms? So what happens because of this? Clinging behavior. Nothing but so too much of attachment is clinging. Okay, so clinging behavior. Nightmares about separation. They'll have like nightmares. They sometimes dream. They'll have in dream itself panic attack, like thinking that their loved one left them. They are alone. Um, they are so alone, like that. Okay. Refusal to go to school or work. I told, right. They'll not go to school. They'll cry every morning. Same. See, in school nothing bad is going to happen to them, but to leave the mother or father, they'll cry every day. No, I won't go, I won't go, I will not go there. So that is what separation anxiety is. So nightmares about separation, refusal to go to school or work. So this is majorly seen in children. Okay, majorly it's seen in children, but nowadays adults also having this problem. Some adults can also have this problem. So these are the six type of anxiety disorder. The six types clear. What are the six types we saw? What are the six types we saw? So we saw about Generalized anxiety. Generalized anxiety disorder we saw. We saw about phobia, specific phobia. We saw about social anxiety. We saw about separation anxiety. We saw about panic disorder. And one thing is missing here. What is missing here? In this picture, we saw one more type. There are only 5 types are given. What is that one more type?
Agoraphobia.
Yes, very good. Agoraphobia. Because why they didn't give in this means that is also a type of phobia, right? So they didn't give here. So agoraphobia also we saw. Yes, next. This one all we finished. Yes, so what are the treatments? So for every problem we saw causes, we saw types, symptoms. So what is the treatment? So basically psychotherapy is the treatment. So psychotherapy is nothing but, as I mentioned in last class, it is talk therapy. Okay, talk therapy is psychotherapy. The counselors will talk, right? So that is basically psychotherapy. First, in the talk therapy, we have cognitive behavioral therapy. Second is acceptance and commitment therapy. Third is dialectical behavioral therapy. See, people, there are so many type of psychotherapy. Just don't think only we have this three. We have client-centered therapy. We have like counselor-centered. We have so many types of therapy, psychotherapies. Just here for anxiety disorder, we are seeing this three. So just that, don't think like only this three is available. Okay. So what is cognitive behavioral therapy? Most effective evidence-based therapy. Evidence nothing but proof. Most effective proof-based therapy focuses on identifying and challenging irrational thoughts and changing behavioral patterns. Here nothing but the counselor will put a table, okay? He'll draw a table. He'll draw a table, and this side of the table he'll put like from when the symptoms are there. Just think like from when you're having difficulty to go to open places. For example, I'm taking agoraphobia, okay, to understand it well. So, what are the irrational thoughts you have? Okay, on avoiding the open place. Why you are avoiding? Because of agoraphobia. Okay, what are the thoughts you are getting? I get like someone will attack me. So he'll put in the box. Okay, he'll put in the divisions, and in that he will also add changing behavioral patterns. Like he will identify the problem. He will challenge the irrational thought. He'll just ask the questions like, okay, what happens if you go? Okay, what he'll tell something worst will happen. So he will ask, what is the worst you're thinking that will happen? Which is challenging his irrational thoughts and with that changing behavioral pattern. So he'll suggest, the counselor will suggest, okay, just try going tomorrow. If you don't want to go to market, don't go. Just go to the nearby shop, the small petty shop. Try going there. So changing behavioral patterns. Okay, in this exposure therapy is also a part of therapy. Exposure therapy is nothing, people see. It's one of intense therapy, nothing, right? The person, let's keep the person is afraid of height. Okay, what happens means suddenly exposing them to height. You're taking him to some 15th floor and making him stand in the terrace. Think about, he is already fearful about fourth floor itself. Making him go to the 15th floor, what will happen to him? So suddenly putting the person to the exposure. But here, see, so many things are should be taken into consideration. The age of the patient. If he is 60 and above, he is 55, already having heart problem. You are going and putting him in the terrace. You are exposing him. What happens? Seriously, he can have some heart problem, right? Heart block, right? He can get a heart attack, right? So here in exposure therapy, you should be very clear. You should know about his medical condition, his age factor. So you should have the confirmation like nothing will happen to him if you expose also. Because if you expose, what happens? Intense fear comes to the person, right? Panic attack will come, right? So in that panic attack, nothing should happen to the person. Okay. So that is one of the thing you should consider in exposure therapy. So exposure is not for everyone. It is a part of CBT that helps treat phobias and OCD by gradually exposing individual to feared objects or situations. So first, we'll start by step only. The I told, right, suddenly they'll take them to the 15th floor. That is called flooding. It is not mentioned here. So it is another one type called flooding. That also comes in anxiety, but it is not advisable basically because that can lead to some other problems. So here exposure therapy is gradually exposing individuals. So I mentioned about flooding therapy. That also it's a part of psychotherapy. Okay. So acceptance and commitment therapy. The name itself indicates what is acceptance and commitment. Just we are acknowledging that we have this thought and feeling rather than fighting them. That is why it came to me. Why I alone suffering like this? Why to me? Why this happens to me? The self doubt, the low self esteem. Without all this, just accepting the fact that okay, I am fearful of this. Okay, what I can do to handle this? Understood. So acceptance is commitment is nothing but teaches acceptance of thoughts and feelings rather than fighting them. So focuses on mindfulness and commitment to personal values. Mindfulness is nothing but the anxiety people always they'll be thinking about their past and future, right? Past is I'm not good. I am avoiding the functions, I cannot go there. And future is what if I go and something wrong happens, what if people judge me. So they're always focused in their future, correct? And because of the future they're always having anxiety, correct? But in mindfulness, just you're getting him to focus on his present life. What is his day to day activity? Just clearing out his mind, which is always fully occupied, just giving him some time to breathe and think about the present. You're helping him to think about, focus on the present. That is focus on mindfulness and commitment to personal values. Understood? Clear? So, what is dialectical behavioral therapy? This is nothing, people. The first and second we saw, right? Mixture of two is dialectical behavioral therapy. That is original developed for borderline personality disorder but also used for anxiety. Nothing but it combines CBT means what? Cognitive behavioral therapy with mindfulness and emotional regulation skill. What is mindfulness and emotional regulation skill? That acceptance and commitment therapy. So mixture of, in some people you have to also put him and give the changing behavioral patterns. You should also make the person to accept himself. So using the both, it is called as dialectical behavioral therapy, DBT. Am I clear? Am I clear what is DBT? Okay. Any doubt here? See, each therapy we'll see in detail. Now, just if you understand, that is enough for me. So, dialectal is usage of both the therapies. Mixture of first two is dialectal. Okay, okay. Sorry, I cannot change the slide. 1 second. Why it's not changing? Okay. So, second is medication. This part we don't deal with this part, but just know it. Okay, medications is basically given by clinical psychologist or psychiatrist. Normal counselors, normal therapist, psychotherapist, psychologist, they will not suggest medications. Okay, but they will study about medications, but they will not suggest. Okay, just know that. Okay, just know it that medications also it's involved. Okay, in that some types are there like selective serotonin. I told, right, anxiety comes into picture, serotonin comes into picture. Serotonin is neurochemical transmitter. The changes in serotonin will cause the person to feel anxious. Okay. So SSRI, selective serotonin reuptake inhibitors. SNRI, serotonin non-epinephrine reuptake inhibitors, benzodiazepine, short-term use only, beta blockers. This everything it deals with brain. Okay, the name itself you can see everything it deals with the brain. So we cannot suggest this medication. Just know for name, like medications are used. Okay, not no need for go into that example details and all. Just know SSRI is used, SNRIs, benzodiazepine, beta blockers. Okay, this we have to know. Lifestyle and complementary therapy. The picture itself is given, right? Medication, psychotherapy, self-help. So exercise. So exercise is one of the best thing therapy because it reduces stress and it boosts mood. Okay. Mindfulness and meditation means helps manage anxiety. Mindfulness, I told, right? Being at present. Be present at present. That is mindfulness. Be present at present is mindfulness. Healthy diet. Avoiding caffeine and alcohol can reduce symptoms because caffeine is proved that taking excessive caffeine or drinking coffee may have changes in your neurochemical transmitters. See, people will tell, right, I feel sleepy. I'll just drink a coffee and I'll come so that I'll feel fresh. Because caffeine helps us to feel fresh because it is involving with our brain. It just makes us feel fresh. Here in anxiety, the person already is having sleep issue. What if he takes caffeine also? He'll not even sleep at all. That's why avoiding caffeine and alcohol can reduce symptoms. Support group. Provide emotional support and coping strategies. Okay, these are the three things we saw. So, what are the three things? Treatment, psychotherapy, medications, lifestyle changes. So, this one, see, whatever we have learned so far, the 6 types, I've put in a box. Just go through, no? Any doubt you can ask. Just whatever we have discussed, I've put in box. Just take 2 minutes and just go through. Types, key symptoms, and common treatments. Okay. Nothing but whatever we have discussed, I put in a box. That's it. Okay. Okay. So yeah, Christine, we'll see some quiz. Okay. In this now, once again. Yeah. So I'll start it. Sorry. One second. Yeah. So I want you people to put answer in chat box. I'll read the question. Then you can put which of the following. Sorry, the screen is not. Yeah. Now can you see? Yeah. Which of the following is a core symptom of generalized anxiety disorder? Hallucination, excessive worry lasting for at least 6 months, memory loss, fear of social interaction. So first one, yeah, I'm opening the chat box. Yes. Afrin 1B. Yes. Others? Just very good. Very good. Yes. So excessive worry that we have at least for 6 months. Sorry, minimum for 6 months is generalized anxiety disorder. Very good. Yes, people. Second one, a sudden episode of intense fear accompanied by physical symptoms like chest pain, dizziness is a characteristic of what disorder? Social anxiety disorder, phobia, panic attack, agoraphobia. Simple question. Simple question. Physical symptom, chest pain, dizziness, intense fear. Intense fear. Note the keywords. Intense fear. Yes, very good. Yes. It is panic attack. Which of the following is a yes? Which of the following is a common treatment for most anxiety disorder? Electroconvulsive therapy, hypnosis, psychoanalysis, cognitive behavioral therapy. That is CBT. Most used CBT. Wonderful. Yes. Yes. So it is the common treatment. Okay. Yes. Very good. Very good people. Yeah. Which, yes, good, good. So, which disorder is characterized by fear of being separated from loved ones? Social anxiety, separation anxiety, panic disorder, specific phobia. So, loved ones, yes, very good. Yes, separation anxiety. Next question. What is the main fear in social anxiety disorder? Main fear, okay, fear of dying, fear of being judged or embarrassed in social situation, fear of animals, fear of germs. Yes, very good. I hope you guys understood. Yeah, because no one made any mistake. Everyone are very clear. Okay. The last question, you will not know it. Okay, that also. Which of the following is not classified as an anxiety disorder in DSM-5? Social anxiety, panic disorder, obsessive compulsion, agoraphobia. Yes, very good, Afrin. Because I didn't even deal with this topic yet. But yeah, by common sense you can answer because we saw about all the three. Only OCD we did not see. Then it is not coming under DSM-5. Very good understanding. Yes, yeah, it is not classified. Yes, very good. Yeah, very good. Yes, that's it. Mm, yes, anxiety disorder. So, yeah, we saw in that question, right? So, everything comes under this. OCD and all will not come here. Okay. So, shortly we'll see what is generalized anxiety disorder. We saw, right? This is, see, here, whatever explained, it's based on that book. Always I'll tell no, they'll go through two books, ICD, either ICD 11 or DSM 5. So this is according to DSM-5 because we have to follow one book, right? So DSM-5. So excessive worry for 6 months. Symptoms we already saw, so no problem. Again, we don't have to go through. Second is panic attack. So this is recurrent panic attack, sudden fear plus physical symptoms. Third is specific phobia. So that is irrational fear of specific object or situations. Okay. This also it lasts 6+ months. So everything to tag it as a disorder you should have for minimum 6 months of period. Next is social anxiety, fear of being judged or embarrassed in social setting. Agoraphobia, fear of 2+ public situations. Fear of no, sorry, fear of public situation. That's it. Fear of not being able to escape or get help. This and all we saw, no problem, nothing to explain much. Separation anxiety also we saw fear of being separated from loved ones. Last, see the time alone 6+ months means adults, for children 4+ weeks. It is one month, more than 1 month. Here one more type is given in DSM-5 for anxiety. Just note it down. For this only I have added the book version also. Selective mutism. Selective mutism is consistent failure to speak in social settings. Example, school despite speaking in others. See, they cannot even talk. They are in group, okay. For example, the teacher every day they will take attendance. Simple example. You just have to answer, here I am, or yes, I am there. The child, no, he'll be so fearful that what if other students, if I tell here I am or present, everyone will see me. So I cannot even talk. Selective mutism. There I have to answer, but everyone will see me, so I'll get anxiety. Because of that, I will not talk there. But other times I'll talk. Only when the teacher is asking the question, I will not talk. So that is only selective mutism. Mutism is in specific time they will not talk, despite speaking in other times. Okay, this also comes under here. This is something different, just note it. This is basic, generally for kids, they'll have this selective mutism. See, at home, they'll be talking. When some relatives comes, no, when you tell them to talk, they will not at all talk. They'll not at all open their mouth. So that is selective mutism. So it lasts 1+ months. Yeah, this is what that quiz answer. What's not included, but related. Related means what? It will come under some other heading. Okay. First is OCD. Why OCD did not come here means in anxiety disorder, it is separately moved to obsessive compulsive and relative disorder. It is separately put into another one topic and it is kept separately in the book. So it is not discussed here. Next, PTSD, post traumatic stress disorder. So this also separately it is put into trauma and stressor related disorder. That's why we do not see that. See, there also anxiety will be there. There also the person will be avoiding the social situation and all. But that did not come here because it is kept into a different topic. Acute stress disorder. This also kept into trauma and stress related disorder. Okay. That's why this and all did not come here. We just saw 6 types generally, and according to DSM-5, we saw 7 types. Is it clear? Is it clear, people? Okay. So, any doubts in this? I hope I took, like, I explained each and every topic line by line. Any doubt? Thank you. Thank you. Yeah. So here, yeah, no doubt. Yeah. So any doubt you have also, you can note it down. Okay. No problem. We will surely will discuss it in upcoming class. Okay. So no problem and all. Just know one thing here. Okay. Each disorder, it will be like, for seeing it will be like same. Okay. Thank you. I too enjoyed like taking these topics. These are all very interesting topics to be. It is very interesting because everyday life we are coming through these terms, the anxiety, the panic, the phobia, and all. But we will not exactly know what it is. Basically, we will use the words, but we will not know what are the symptoms, how many months it. Now you have an idea. For at least 6 months, if it is there, then it comes under a disorder type. If for one day it is there, it is basically for everyone it happens. For 6 months it is coming under disorder, so we'll know the difference what is happening around us. So yeah, we saw types and all. Here so many things are there. Slide. Okay, till now they did not share any slide. Okay. Okay, don't worry. Today I will send to Sumaya and I'll tell her to share. Okay, don't worry. Today you'll get the slide for this. So we saw about the treatments, lifestyle changes. That's why regular people, all should do exercise and all. We should all eat healthy because anyone can have like any issues. Like from class one. Okay, I'll tell them to share today. First, I'll send them and I'll tell them to share. And we have to do meditation for sometimes to manage our stress because acute stress can lead to any problem. Okay, for that only we saw the types, we saw the key symptoms, we saw some questionnaires also. DSM-5 we saw because
according to book also we have to go through. So that's why DSM-5, and in that we saw a separate division called selective mutism. This is basically in children. Children, they'll face this selective mutism. What's not included? And yes, thank you. Any doubts you have, kindly note it down. In next class we will surely will see that. Okay, next class we are having on Friday, I think. Yeah, thank you. Thank you, people. Thank you for attending the class. Yeah, thank you.